Hey, everybody. This is Jordan McConnell with the Crohn's Veteran Podcast. Thank you so much for joining me. I am grateful and honored to have a very special guest with me today, Michael Currier. He is hailing from Boston, Massachusetts. He is a Crohn's warrior himself, and he also works for an awesome company called Oshi Health, which is, helps people with IBD as well. So I'm really excited to hear his Crohn's story, and I'm really excited to hear what he does to help people with IBD too. So Mike, how you doing?
I'm doing great. Thanks for having me. I'm glad to be here.
Thank you so much. And so yeah, I just want to get right into it. The last few episodes, I haven't had the opportunity to really get that firsthand patient experience with Crohn's for folks out there that are listening to the show. And so I know from us talking a little bit that you've had Crohn's since 14, which is a lot. So please share.
Sure. Well, like I said, much like yourself, going back to 14, there's a lot that happens in that time span. So I'll sort of give you the short version, and then if you want to revisit anything, I'm happy to talk about anything you have questions on. But yeah, as you said, I work with an amazing group called Oshi Health right now. I'm a physician assistant or physician associate. So I see patients with all kinds of GI issues. I specialize in IBD, Crohn's and colitis. We take sort of an integrative health approach, dealing with the whole person in order to help get them better. And we can talk a little bit more about that. But my sort of journey to that is a more personal one. I was diagnosed with Crohn's disease at the age of 14, I think freshman year in high school.
Yeah.
And at that time, I think I had a some providers who maybe didn't quite know what's going on, and sometimes that happens, especially when you're young and they're not sure what's happening. And I was told that my weight loss and the bleeding was due to my Italian temper, and not an actual diagnosis. So advocating for myself, and we sought out other providers and sought IBD specialists, and came up with the diagnosis of Crohn's disease. Over time, went through high school with that. At the time, there was just prednisone and immune suppressants. So it wasn't optimal. I spent a good deal of my time in high school on steroids. So I know what that's like to gain the weight from that and have a puffy face through high school. And then in through college, once biologics started coming out, got on those, and that helped to get things under control for a while. Ended up in sort of a phase there where I had some side effects from those and ended up in the hospital for a good amount of time with tuberculosis, which at the time they didn't realize could happen from the biologics. Now we test for those things. And had gone through a number of surgeries and medications, and diets and everything in through college and up through where I am now. Had a good period of sustained remission over the past maybe 10 years or so on biologics. And then recently over the past year, lo and behold, things have started stirring again. So I'm drinking my bone broth today and being a good IBD patient, following my own advice. And, we do what we have to do.
Well, thank you. Thank you for that. Yes, we do. And so, when you were when you were younger, what was your mindset like? How did that impact, I guess, yeah, maybe you and your family, like the people around you, your friends, family, how did they, kind of react to this diagnosis?
Yeah, I mean, I think when I was diagnosed, it wasn't something that I feel like at the time people really knew a lot about or hadn't heard. So I think I was like one of the first people that they knew to have this. So there were a lot of questions about, what is this even? Now it seems like it's a lot more prevalent and people are aware of it. But thanks to even podcasts like this, where people are bringing awareness to it. But at that time, people didn't know. So I had to do a lot of explaining. And it's not always fun to have to explain exactly what's going on in the symptoms, right? So you generalize and you say, I've got stomach problems, right? And that doesn't really do it justice. But so there was a lot of that to explain that to high school friends, stomach problems, and they were okay with it.
Mm.
Family members, obviously more concerned because they see the weight loss, and coming from my family, they love to feed you, and if you're not feeling well, they just want to feed you even
Right,
more.
right.
So that there was a disconnect there. Um, but yeah, there was sort of a lot of explaining and trying to find the right way to frame it for people so that they understood what was happening, but they weren't sort of taking pity on me either. So I think a lot of it has to do with sort of how you sell it. If you're kind of taking ownership of it and you say, look, I have this thing, but I've got it under control and it's not an issue, then I think most people take it as that. Whereas if you don't do that and you start to really you know go into a place where you're feeling bad for yourself, other people start to really get concerned and wonder if they should be doing the same thing too. So even like early on with like girlfriends in high school or whatever, I had to sort of be like, nah, I'm fine, I'm good,
Yeah, everything's great. Yeah.
which right. Which wasn't the entirety of it, but it worked for the time, sure.
I definitely thank you. I mean, I definitely remember when I was younger too, like, nobody, my mom is maybe like maybe like a not inflammatory, right? But like, but more like an irritable bowel, right? And so I'm thinking that I just got it worse. But beyond that, like, there's nobody in my, no friends, no family, have Crohn's disease, didn't have anybody to bounce that off. After my surgery when I was 14, I didn't really have any problems for another 13 years. And so like,
Oh, wow.
and so it was really, yeah, so I didn't really kind of forgot about it, type thing. It's kind of really, 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 really in the back of my mind, but it kind of like what you were just saying, Crohn's has a tendency to remind you that you still have it often. So, and
Right.
and
Right.
so
It'll tap you on the shoulder every once in a
right,
while.
right. And that was when I was 27. And so I've been dealing with Crohn's kind of pretty much every day since then. And so, but since probably around this time of the year, maybe like March, February, or March, April of like 2009, something like that, and so I've been dealing with it ever since. And so, but even then, like, the reason that I have this show, the reason that I'm doing all these, created the merch and all these other kind of things is because I literally didn't know anybody that had Crohn's at all. And so I kind of just, dedicated it. I was like, well, if I don't know anybody, that must, even if they're out there, it's not easy enough to find them. And so, so I got to be the change I want to see in the world. And so, so what, and so, right. And so you were saying that, so you've kind of been sick. And so like right now, when you're, not feeling well, or, or you're in like, flare, I guess they call it, and, or just active Crohn's symptoms, how, what's your kind of self-care regimen look like for that?
Yeah, and so it's interesting because I haven't had to do it for a while. I sort of got away with doing really, really well for a while, and then for whatever reason, either my medication either stopped working or my body just changed. Whatever it was, we needed to sort of pivot. So I'm in the middle of trying some new medications right now. And like anybody else, even though I'm a provider, I still have issues with insurance coverage and things like that. And so you end up waiting weeks and weeks for things to be approved. And so I said, all right, well, I need to take some responsibility here and do what I can. So I've started meditating again. I have started a couple of days ago doing kind of an elemental diet with nutritional shakes and bone broth, which kind of helps to calm things down a bit. Mainly that right now. And
Question.
that's just sort of waiting until I get some of the other new meds on board.
Thank you. Thank you for sharing that. And so like, so the nutritional ways that like the nutritional shakes and stuff, like I've had trouble personally by finding ones that like sit right on my stomach. So do you have like any kind of recipes or any kind of brands, not to like, shout anybody out or anything, but anything that you've found that, kind of sits on your stomach, okay?
Yeah, well, it's tough. It's tough because a lot of the elemental formulas that they use now have a lot of sugar in them, right? And sugar can be very inflammatory. And some of the first ingredients are corn syrup and high amounts of sugar. So finding some that aren't essentially a candy bar with a multivitamin stuck in it is tough. So I'm experimenting with some now. One is a sort of a pea protein base, and it is gluten-free and lactose-free,
Mm.
because I find with sugar and dairy sometimes those can cause some symptoms. For me, it's different for everybody. Um, I'll be experimenting with that this week. I'll have to let you know how that goes. But
Thank you.
other than that, sometimes I'll do my own. So I'll make a bone broth, and then I'll add some things to it. So I'll add some collagen protein to it. Sometimes about 20 milligrams of collagen protein, some branch chain amino acids, some
Like to
L-glutamine.
the
Um,
bone broth?
yep. So you can put some of those things in and sort of make your own elemental formula
Mhm.
that has a little bit of extra gut support in there as well. And sometimes that can be helpful. It at least helps to calm things down a little bit, and can buy you time and work as a good adjunct to whatever other medical therapies that you're doing.
Okay. Oh, thank you for, yeah, that's, I'm always looking, I did not know that. I didn't know, I know people were out there doing that. I knew about bone broth, but I didn't know that people were like putting other, other stuff in it to make it better. And so,
Right, right. And it's not, sustainable. You can't just drink broth forever and have that be it. But I think in an acute phase like this where there's a lot going on, and like for me right now, I'm trying to avoid being being hospitalized between now and when my medication gets approved. You know how it is. You do whatever you have to do. And if that means
right.
drinking bone broth for a few weeks, well, then you hunker down and you do it.
Exactly. So, so when you were like, in college, and I mean, I know, you're a professional guy, your position's associate, right? Is that, and
Yep.
so, maybe for the people that are, are out there like, man, I'm sick, I don't feel well, but I have these dreams of, being, going to medicine or, or just, other stuff, how did you, overcome the adversity of, being sick and, going through school?
Yeah, it was tough because my route to medicine where I am now was sort of a circuitous one. I'd started off um, at Berklee College of Music to be a musician, and then decided, okay, well, I'm not going to be doing this forever. Let me be serious and get a degree in business. So I moved over to a business college, and
Mm-hmm.
while I was at school there and dealing with some of these issues, I met a bunch of musicians. We started a band, and I ended up being a professional musician for about 7 or 8 years,
Awesome.
touring the country with Bare Naked Ladies, Sting, Matchbox 20, Goo Goo Dolls, and had a great time of it.
Mhm.
But life on the road was tough, living in the van and eating,
Yeah.
peanut butter and jelly sandwiches every
Right.
day, and
Right.
doing that was not very conducive to what I was
Mhm.
doing. So ended up with sort of thinking, okay, well, as I exit out of this, what's my plan B? Um, and at the time I was in a hospital bed and really thinking about it at the end of one of our tours, and I was trying to figure out a way to take what I knew and turn it into something. And I said, well, I have many years of learning about Crohn's and colitis, so I might be able to turn this into something. And went to school to become a physician associate, um, and then from there ended up at Brigham and Women's Hospital. I was associate director of program development at Brigham and Women's Crohn's and Colitis Center for a while, and then at UMass Memorial in the Boston area, and now made my way to Oshi, basically because what I was doing at Brigham and Women's at the time was this sort of all-encompassing clinic that had psychosocial care, dietary component, health coaching, and we were trying to figure out how to make that work. And so when I saw Oshi, I said, well, this is great. Here's a company that's really doing it, making it happen, and doing it virtually. So I got into that.
Very cool. Like, so I was gonna ask you, oh, well, yeah. So pardon my ignorance, but so what's the difference between a physician's associate and like a regular and like a medical doctor?
Right. So it's mostly in the training. So I can do everything that an MD does, a doctor does. So physician associates are trained to uh, do adult care, pediatric care, surgery, everything. So we're trained in the physician model. Physicians are trained over a longer period of time, and they'll often have fellowship and a number of years that they're required to do that. Physician associates are required to learn the same amount of material, pass the same test, but we have to learn it in a shorter amount of time, where most of our training is done kind of on the job. So even in my position, the last one that I was in, I was helping to train a lot of the fellows in IBD, in Crohn's disease and colitis, because even though they had an MD after their name, they were still in training, and I had 10 years of IBD experience. So there's a really great collegial relationship that goes on between what we call APPs, advanced practice providers, both physician associates and nurse practitioners and doctors right now, because there's a bit of a shortage of doctors in the GI world. So physician associates and nurse practitioners are helping to fill that gap and are getting really proficient in what they do. So you'll see a lot of APPs that are at the top of their game, doing some really, really great work.
Well, thank you. Well, of course, thank you for all you do, and and all the folks out there that are filling in those gaps. Because out here in Vegas, we the medical system is interesting. So I don't want to. It needs some help, and so
Sure.
I think a lot of places, folks are just overworked and just short staffed and all that stuff. I remember when I moved here, actually, that I was I was talking to a lady, with somebody with Crohn's, here, and she's like, oh yeah, you're trying to get a doctor, that'll be 6 months before your first, before your first appointment. Good luck, good luck with that, type thing. And I remember, like, even I asked my insurance company, like, hey, can you do like a printout of like places I can call or whatever, and so like so they gave me that, and and that was pretty much fruitless. And so and so pretty much I had great care in Omaha, and I've been in Vegas almost, it'll be 2 years in a couple of months, and I still haven't even really even found a GI doctor here. So so folks that so folks like you, are appreciated, So
Yeah, well, thank you for that. Yeah, and I know, and it is tough out there, just the way that things are, and that's one of the things that we endeavor to sort of fix at Oshi is really patient access, and getting patients, or as we call them, members, in an appropriate amount of time, because that gap of that 6 months where you don't see somebody, that's 6 months where you don't feel well, and that's 6 months where you're missing work, and that's 6 months where you're having to explain to your family members why you're going downhill, and you're just waiting for your appointment, right? And so at Oshi, we're able to see people much more frequently, and it's mainly because of the virtual nature of what we do and the availability of our providers. But we can usually get people in within 48 hours, and have frequent touch points. So I can see people every few weeks if I need to, along with other providers jumping in, either dietary or behavioral health. So those multiple touch points really help to keep people's head above water from a health standpoint, without them kind of falling through the cracks and ending up in the ER.
thank you. So yeah, so I did want to get more into Oshi health and stuff, and so yeah, like maybe like yeah, so if somebody that like, let's just use me as an example. I'm coming off the street and say, hey, I mean, I can't find a doctor, or the medical staff or the medical support system that I have is not meeting my needs, and so and I'm looking for a different option, walk me or the listener, through how that process works, and kind of what, and how that program, or that that kind of that care is created for that person.
Yeah, no. So basically, we work with with employers. So employers will often add us as a benefit to their health insurance. So we see patients through certain employers that come to us, but we also work with commercial health insurance to have these things covered. So if you go to oshihealth.com/sign up, you can check things out there, put in your information, and see if you're eligible for the services. We're available in 18 states right now. We're open in, and so we have providers in all of those states. And what would happen is you would have your first visit with either me or one of my counterparts. So you would see a GI specialist first. We would take a look at all of your records. We have a system that will pull in your records from outside hospitals and outside clinics. We would thoroughly review those with you and sort of figure out what your care plan was. If you needed more testing, if you needed procedures, if you needed medications, or if things were relatively under control, but it looked like you needed some other things tweaked in terms of dietary support or behavioral health support. Because the thing about GI really is that it's different from a lot of other health conditions where, if you have a broken bone, it's a broken bone. You go in, you fix that broken bone, that's it. It's isolated. With GI, there are so many different things that come into play. There's a gut-brain interaction that happens. Everything that's going on in your head, your gut registers, no matter how calm, cool, and collected on the surface you are, right? And so there's the gut-brain connection that affects everything that we do. And then there's no way to discount nutrition, right? I mean, everything that intimately comes in contact with your GI tract does matter, right? It's not all of it, but it's part of it. And so if you're not addressing all of those things from a 360 standpoint, then you're not addressing the whole person, right? We're not, at Oshi, we're not just addressing a disease. We're not just addressing Crohn's or colitis. We're addressing a person who has this. And each person is different. They bring something different to the table and have different needs. So everyone is looked at from an individual standpoint, assessed, and we try to see what they need, and then we'll get plugged in with various providers from there on, and we'll sort of navigate your care that way. And so there's behavioral health providers, there are that specialize in GI, the dietitians that also specialize in all these GI states, and there are health coaches as well, and then our care coordinators help to get everything else that you need meanwhile.
Wow. Well, I wish I knew. I wish you guys either existed or I knew about you a long time ago. So, are you in Nevada? Do you support Nevada by any chance?
So not there yet.
Darn. So,
getting there. You're on the list.
All right, cool. Well, let me know when that changes. So,
right. And the other thing too is we can work with existing GI doctors. So if you have a GI doctor that you have and you like, we can work with that doctor, or we can take on your care just ourselves. So we sort of do it however patients prefer.
Like a piggybacking situation or something like.
Right. So sometimes patients will use us a lot more for sort of the dietary and the behavioral health component, and then we'll work together with their other GI provider for some of the other things that they may need. Or if there are procedures that need to be done, we'll work with their existing GI provider to make sure those things are getting done as well.
Cool beans. Thank you. Yeah, that's cool. I'm gonna look at to see how I might be able to take advantage of you guys. And so but for my because I think that the whole, you're absolutely right, that how the whole person concept, that's the Air Force guy in me, but the whole person concept was really, really important. Not just going to work, not just learning your job, but who are you 24 hours a day, right? And are you improving yourself? Like are you helping your community and all these same things? So your body, mind, body, and spirit, like making sure all that is healthy, because all those things interrelate with Crohn's. And so I'm curious, given that you've like me been in the trenches for for a really long time with Crohn's, what are some to me, like you have this kind of inner strength that people just don't see. And so like and so that because you're a lot of the times you're going through stuff that you say, yeah, it's out of your face, it's at the background and stuff. So you're kind of, so, so if you have kind of outside frustrations, external frustrations and stuff, you still have this internal condition that you're, you know, like dealing with every day. And so, and so to me, it's, to me, like those people are really, really awesome. Like, to me, like, and so what I'm curious about is, any kind of wisdom, or any kind of, insights that you picked up, kind of the silver lining, for you, living with Crohn's.
Yeah. No, that's a really great question. And picking up on what you said, the silver lining, I think it's important to find your silver lining, right? You have to be able to look at it and say, Crohn's disease or ulcerative colitis isn't who I am, right? It doesn't define me. It's not all that I am. It's a part of my story, right? And you can look at it and say, well, this thing happened to me and it destroyed my life. Or you can look at it and say, I've done all of these things in my life in spite of having ulcerative colitis or Crohn's disease. So it's a part of your story, and it almost makes your story better because you're able to do these things even in the face of this other adversity. So oftentimes finding your silver lining and saying, okay, well, I have this thing, but if I didn't, what would things necessarily look like? For me, would I have met my wife? Probably not. Would I be in medicine helping lots of other people doing this? Probably not. Um, you know, would I be very much overweight right now because I love pastry? Maybe. But all of these other things have sort of forced moderation on me and changed the course of my life to get me where I am now. And I wouldn't be without them. I have three beautiful kids, a wonderful wife, and a wonderful people that I work with. And I don't know. I don't know what my life course would have been without it. So sometimes it's tough to sort of thank Crohn's disease
Right.
and ulcerative colitis because of what it does. But I think it's important to understand, and this is something I tell my patients, that like everybody has something. Whether it's a medical issue or some other issue going on in their life, everybody has something. Nobody gets through this life without some weight that they have to bear.
Big
This just
facts.
this just happens to be your something. Your something is ulcerative colitis or Crohn's disease. The good news is that this is something that we can do something about. We have medications for this now. We have approaches for this now. So that if it's treated well, it can be, at most a nuisance for you. But it's something that we can do something about, right? And so if you're going to have ulcerative colitis or Crohn's disease, now is the best time to have it because we have all these medications that we didn't have before, and we know so much more about it now. So yes, you have it, but at least it's something that we know what to do with now, and we can for the most part fix. And so it's doable. You can get through it. And I think, I'm no different than anybody else. I don't think I have any skill set that's different than anybody else. And if I could sort of do all these things, I'm a firm believer that anyone can. It's just a matter of sort of reframing it for yourself, so that you understand where it sort of sits in your life and how it contributes.
Cool. Well, thank you. Thank you again for that. Um, if if somebody, well, I'm gonna kind of wrap it up here a little bit. But if somebody, again, wanted to, reach out to you guys, and set up an initial consultation appointment, what's the easiest, most effective way to do that?
Sure. So it's, oshihealth.com/sign up. But we're also active on social too. So you can find us on Instagram and Facebook as well. Yeah, reach out and I'll tell you whether it's me or any of the other providers here. People will say, is there someone there that you can suggest to me? Everybody here is amazing. I've never worked with a more caring, talented group of people. So anyone you interact with here is top notch. So we would love to help you out if we can.
Cool. Well, with that, Mike, I greatly appreciate, it was just, I mean, like you asked me like how I reached out, it was just like a cold call, like it's so, so I just, try, I'm always trying to, to find, people to share their stories, and so I'm just greatly appreciative, for you, sharing your time today, I'm, pretty much on short notice, and so, so it's just, so thank you for that. For everyone listening, if you found, value in this, and what I'm doing for the Crohn's Veteran podcast, please support, share this podcast, listen to it. We're on all platforms. We're on, Google Podcasts, Apple Podcasts, Spotify. I think there's several other ones. And I have a YouTube channel. You can check out the website. We're on crohnsveteran.com, the merch store, crohnsveteranstore.com. All that good stuff. I wanted to do a cooking channel, and so with the whole like mind, body, and spirit, right? So putting better things in my body, and so I think, and I know, and trying to, and my son wants to do it with me. So I think that'll be really fun. But he's like, well, in exchange for that, Dad, could I have a streaming gaming channel? I'm like, so like,
Of course, there's always an angle.
There's always an angle, right? So, so that might, so we'll see how that's going to work out. But yeah, but I'm, my dream is to, grow Crohn's Veteran and to impact, thousands of people, or as many people as I can all over the world. And so, so again, please, help me, share the love, and and bring awareness to Crohn's and colitis. So, so again, Mr. Michael. Actually, doctor. Can I call you doctor? Do people call you doctor? No.
No, it's not. I'm not a doctor. So Michael is fine.
All right. Well, try to show you. But all right. Well, Michael, Michael Currier. Thank you again. For being here and sharing your Crohn's journey, and and thank you to Oshi Health, for what you guys are doing for the IBD community too.
Yeah. Well, me, and thank you for everything that you're doing too. If anything you need from me, I'm more than happy to help you out here, because I think what you're doing is a great thing.
Awesome, thank you. I appreciate that, and thanks again, everybody, for listening.